today is all about salbutamol if you're in Europe or albuterol if you're in North America, but either salbutamol or albuterol is all the same. The commonest brand name is Ventolin, though there are a lot of brand names everywhere. This medication is pretty helpful in the face of bronchospasm. Even some use it in premature uterine contractions. Also helpful in dealing with hyperkalemia and exercise-induced bronchospasm prevention. And in the face of anaphylaxis, some will make use of this. So it's not only asthmatic patients or patients with COPD that will be making use of salbutamol. So if we know that this medication is pretty helpful, then do we know that there are other side effects and warnings and precautions to be taken? Without further ado, let me welcome you to my channel once again by saying thank you for visiting. Please remember to subscribe if you haven't subscribed, and remember to share this with all your friends. It is all about salbutamol or albuterol or Ventolin. Let's go. To avoid confusion, I've decided to leave a note here that though this presentation is all about salbutamol, but it is going to be called albuterol in US and some other parts of the North America like Canada and Mexico. But it is going to be known as salbutamol in Europe, Asia, Africa, or the brand names they are used to in those continents. It is a rescue agent in acute phase. Acute phase of what? Acute phase of asthmatic attack or any form of bronchospasm. And the bronchospasm here could be caused by allergies, could be as a result of COPD, could be due to chemicals, it means strong perfumes, paints, bleach, and so on. Could be as a result of general anesthesia or pulmonary infections, cold air, smoke inhalation, could be exercise-induced or as a result of certain medications like non-steroidal anti-inflammatory drugs or non-selective beta blockers. All these could cause bronchospasm. So it's not everyone who is on this medication that is asthmatic or having COPD. So we use this medication in so many different ways, including pregnancy. You will soon know how we use this medication in pregnancy. So we use it to prevent attacks of bronchospasm, asthma, COPD, and exercise-induced bronchospasm. You will know more in a bit. But certain other medications can affect this very medication. We will go into that also. Then there are different formulations for similar or different purposes. Because I don't want to waste your time, it could come under different brand names. You can pause and check this. The leading brand is Ventolin. Also, down salbutamol, salbutamol, and check the rest. Will be any of this. This medication belongs to the class of medications known as bronchodilators, specifically a short-acting beta-2 agonist. But it depends on the literature you are going through. It might be written as beta-2 agonist, beta-2 adrenergic agonist, all the same. The reason why I have decided to bring it out clearer that it is short-acting beta-2 agonist is because we have long-acting beta-2 agonists. And other members of short-acting beta-2 agonists will include albuterol, metoprolol, levalbuterol, terbutaline, and isoeterine. So salbutamol or Albuterol, depending on whether Europe or North America, is a short-acting beta-2 agonist. Uses. Though we use salbutamol to handle some other conditions like uterine contractions, like hyperkalemia, but majorly we use salbutamol to handle bronchospasm. These may be caused by many things. We'll go through them in a bit. But it's not everyone who is on this medication that is actually asthmatic or having COPD. Why that? We'll know in a bit. So, in asthma, in COPD, in exercise-induced bronchospasm, we use salbutamol for prevention. How? We will know in a bit. In obstetrics, for premature uterine contractions, we can use salbutamol. How? You will know in a bit. In hyperkalemia, particularly severe hyperkalemia, the first thing is IV calcium gluconate. Okay, then we can grab our salbutamol. How? You will know in a bit. In anaphylaxis that is associated with bronchospasm, we use salbutamol. That's why I said we use salbutamol for many conditions, like in obstetrics, in hyperkalemia, in anaphylaxis, but majorly because of bronchospasm. Forms. In form of syrup for per oral use, and that could be generic 2 mg per 5 ml or 0.4 mg per ml. Still on forms, with form of tablet for per oral use. In that case, could come as generic 2 mg or 4 mg, or the extended release tablets for 12 hours per oral use as generic 4 mg tablet or 8 mg, or this brand name as 4 or 8 mg per tablet. Nebulizer. Very soon we'll be talking about nebulization, nebulized salbutamol, and so on. So this is a nebulizer. And I'm free to publish this because this is within my reach. I didn't copy this from the internet or anywhere, so no copyright issues here. Nebulized salbutamol for nebulization, for inhalation, could be under the brand name Ventolin, this strain, Ventolin PF, this strain, generic, this strains, and even 0.63 mg per 3 ml, and so on. The aerosol solution for inhalation. Okay, let me quickly go over this, that CFC-Propelled Inhalers have been discontinued, meaning they are no longer in circulation. If that is the case, only inhalers with HFA, hydrofluoroalkane, are allowed to be in circulation. The CFC propelled inhalers have been discontinued since December 31, 2008. The reason is that it has been stated that they are environmentally harmful, particularly the effects on the ozone layer. Instead, HFA-propelled inhalers only are allowed in circulation. So if you have any inhaler that it is not CFC-free or is containing CFC, then let your pharmacist or your physician be informed immediately. But any inhaler containing HFA, you're fine, like Ventolin, HFA 90 microgram per actuation, or generic, you'll see salbutamol written on it as 90 microgram or 100 microgram, or Proventi HFA 90 microgram per actuation. Okay, I've just talked about CFC inhalers that have been banned, right, or discontinued. So this is CFC free. And this is an example of a generic or Salbutamol HFA metered dose inhaler. So there's no copyright issue here because this is from somebody very close to me, so I didn't copy it from anywhere. So this is an example, okay? Other forms will be aerosol powder breath activated inhalation, and you can find these brand names there as powder breath activated inhalation. When you're looking for aerosol solution inhalation as sulfate, you can pause and go through this. Then solution for intravenous use will be under the brand name Ventolin as 1 milligram per ml. Administration. If this is a pediatric age group and the child is less than 4, if we must use metered dose inhaler or nebulize salbutamol in the nebulizer, then we must use face mask with or without spacer. If the the child is greater than 4 but less than 5, then we must use spacer with inhalation aerosol. Dry piece of cloth is expected to be used for the cleaning of the devices when we are using the inhalation powder. Tablet. The tablet will come as immediate release or extended release. When it is extended release, just take whole. No cutting, no shrink, no crushing. And of course, you know how to give the syrup. Nebulization. Forms that are 0.5% should be diluted before use. You can add other medications like ipratropium. In fact, there is a combination known as Combivent that contains ipratropium and salbutamol. Or you may add budesonide to the combination of Combivent. So you can have salbutamol, ipratropium with budesonide or with fluticasone. Just one of these could go with ipratropium and salbutamol. Then deliver the entire dose between 10 to 20 minutes. Can use a mask or mouthpiece. Mouthpiece mostly in adults or older children, but it must be placed in the mouth. The dry powder inhalers. ProHair Digihaler or ProHair Respiclick will be the brand name. It is breath activated. You don't need to prime this. No spacer or volume holding chamber is required. Then don't clean with water, please. Use dry cloth for cleaning. Dry powder discus. You need to activate the discus. You breathe out fully. Then you inhale the medication and hold your breath for as long as you can. Don't exhale into that very discus. Watch out for the countdown to 5 with red color. It is better to have the discus dry always. The IV infusion. We must dilute the preparation to double the volume before we can infuse. Then infusion pump is expected to use for the continuous administration. Metered dose inhaler, HFA. We must prime before the first use. Also, if this is not the first use, you've been using it before, but you've left that inhaler for a long time, like 2 weeks or more, then you must prime before you use. The priming is done by releasing the first 3 to 4 sprays into the air. Then you have to shake well before subsequent use. You can use a valve holding chamber with or without spacer. Please clean this inhaler with warm water twice every week and completely air dry before use. Now, contraindications. When there is sensitivity to albuterol or salbutamol, remember, depending on where you are on the surface of the head, is the same, right? Or any components of his formulation, then we will not use salbutamol here. Also, if the question is, do you have allergy to milk protein? If the answer is yes, then don't use the dry powder inhalers in anyone with milk protein allergy. In anyone with tachyarrhythmias, somebody will say arrhythmia is arrhythmia. Why not defining it as tachyarrhythmia? Meaning the heart is beating irregularly but beating very fast. Because arrhythmia could be bradyarrhythmias. When it is tachy, no salbutamol. Why that? You know in a bit. Contraindications in pregnancy. We don't use inhalation formulations as tocolytic agent. No. Meaning a woman is having premature uterine contraction and you want tocolytic agent and then you are looking for the inhalation formulations of salbutamol. That is wrong. Abortion can actually occur if injection formulation is used in the first or second trimester. So, should we not use it at all? And to those who are using it, when can they use it and which formulation? You know in a bit. Adverse reactions. I've decided to start with hypokalemia, and I've decided to write it down that I must give further explanation. The reason is that we have to be extremely careful in anyone using any formulation of salbutamol that it can drive the potassium to the low level. Hypokalemia can occur. When it is moderate to severe hypokalemia, there may be paralysis, honestly. There may be arrhythmias. And when you run your EKG, be looking for U wave. Check the T wave. It's likely going to be inverted. And the SC segment will be depressed. The patient will complain of cramps and muscle pains and generalized weakness. If it is a mild hypokalemia, it may be asymptomatic. Remember, we actually need salbutamol. No, other medications are helpful, like intravenous calcium gluconate, insulin, salbutamol, glucose when we are dealing with high potassium level, right? So it means it can turn hyperkalemia to hypokalemia. Now, somebody having normal level of potassium, now taking salbutamol, what do you think we're running into? Hypokalemia, okay? And diuretics being used at the same time will give us that. Insulin being used at the same time. Mineralocorticoids like fluorocortisone, glucocorticoids, even coffee, high level of coffee, or excessive laxatives. Somebody is asking me, how can excessive laxatives give us hypokalemia when I'm just using my inhaler, repeatedly? Of course, when you are losing the potassium through diarrhea and you are now using your salbutamol high dose, then potassium is dropping and dropping the more, and that could actually kill. Now, other adverse reactions will include tremor, nervousness or excitement in children, paradoxical bronchospasm or exacerbation of the underlying pulmonary disease in some patients. Upper respiratory tract infections like pharyngitis can occur. Still on adverse reactions, there may be tachycardia. That is why I said salbutamol is contraindicated in tachyarrhythmias. So when the abnormal heart rhythm is the upper side, it is fast, then we will not give salbutamol because salbutamol on its own can give tachycardia. ECG with SC depression, increased blood pressure, chest pain with angina pectoris, flushing, AFib, hypotension in some, dry mouth, tongue ulcer, increased glucose or ketoacidosis, metabolic acidosis, or lactic acidosis, all these just saying the same thing, right? Increased appetite or change in taste, nausea, vomiting, abnormal liver function test. Other adverse reactions will include urinary tract infection, difficulty urinating. There may be pancytopenia or lymphadenopathy. I'm not saying all these adverse reactions will occur in everyone, but it's good that we'll let anyone that will be on these medication for a long time to know that it is a possibility. Others will include hypersensitivity reaction, flu-like symptoms, diaphoresis, or urticaria. That is those who will be highly sensitive to it. Conjunctivitis, otitis media, tinnitus, sleep disturbances, muscle spasm, mydriasis, or asthenia. In children, there may be insomnia or hyperactivity. Oral formulation may give children certain hypersensitivity reactions like Stevens-Johnson syndrome or erythema multiforme. If the child is on Albuterol, he or she can come down with upper respiratory tract infection. Warnings: cardiovascular system. For anyone that will be on Albuterol or Salbutamol for a long time, then we must check cardiovascular system very well. That is before the commencement of the medication. Even while on it, we'll keep an eye on the cardiovascular system. Whether potassium, severe hypokalemia will lead to arrhythmia. The EKG will change with U-wave, T-wave inversion, ST segment depression. In addition to that, there will be prolonged QT. If, unfortunately enough, we place this same patient on haloperidol, then that will be additive negative effect on cardiovascular system. The QT prolongation will be more, going down the hill to tozadipone. Tozadipone going down the hill to ventricular tachycardia, monomorphic, polymorphic, on ventricular fibrillation. Without defibrillation, then going down to asystole. If there's no advanced cardiac life support, what is next? The patient is in the more dead. When it comes to diabetes mellitus, salbutamol is not there to help you. Salbutamol will worsen the situation, will shoot the glucose more up, then you think that you're not winning. You've done everything, you've followed the rules and regulations as per diet and exercise and everything like that, but you are not winning. Is because you're on this Salbutamol or Albuterol on daily basis for a long time. Check and go back to your physician. Still on warnings, inhaled forms can lead to paradoxical bronchospasm, and that could be fatal, meaning could lead to death. One good news here is that the paradoxical bronchospasm is rare. Now let me explain further that this very page will be helpful not only to my colleagues, but to the patients who will be taking this medication. Why that? Because this paradoxical bronchospasm is a possibility, then use this only as being prescribed, meaning the expected doses and the very formulation that has been prescribed to you. Don't grab the one from your grandfather, your grandmother, or your friend, your spouse, and use it anyhow. The formulation you are given is for a reason. Certain formulations may actually lead to paradoxical bronchospasm, and that could lead to death. Now, it may cause increased intraocular pressure in glaucoma. We don't want that, right? Can increase thyroid activity. So someone already diagnosed with hyperthyroidism, then have that discussion with a pharmacist around. Hypokalemia. Yes, you could see that I've mentioned hypokalemia in the course of this presentation for almost 3 or 4 times. That means we cannot overemphasize the fact that we must keep an eye on the value of potassium if someone is on this medication. We have to be careful in renal impairment. It can increase central nervous system stimulation. So if that is the case, anyone with seizure disorder or epilepsy, we have to be careful. We should go over the adverse reactions once again before placing that man or woman on this medication on a long-term basis. Drug-drug interaction. Those who are used to my channel will expect me to say, okay, contact your pharmacist or clinical pharmacologist, then I'll move on. Today, I will not move on. I'm going to stay to explain some facts here. When it comes to beta blockers, the non-selective beta 1 and beta 2, like propranolol, would decrease the effect of these selective beta 2 agonists on bronchioles. Why that? Okay, the antagonistic effect of propranolol on beta 2 will have effect on bronchioles. Then we'll expect the outcome of administration of beta 2 agonists to still be the same when there's another agent hindering that same effect. That would be difficult, right? So it's not that there will be no effect, but it will be decreased. High dose of beta 1 selective agent can affect the agonistic effects of these beta 2 agonists on bronchioles, like atenolol or metoprolol. High dose will affect the effect of beta 2 agonists, salbutamol or albuterol. Okay, still on drug-drug interaction, unlike other days that I'll just walk away, let me delve more into hypokalemia. This is the 4th or 5th time that I'll make reference to hypokalemia here. That means it is a serious matter, right? Okay, we will run into serious hypokalemia, severe hypokalemia to be precise, when we use this salbutamol with these other medications: loop diuretics, furosemide, ethacrylic acid, bumetanide, right? Thiazide, insulin. Okay, because we actually use insulin with glucose to treat hyperkalemia. Glucocorticoids, coffee or caffeine, high dose. Excessive laxatives with diarrhea, and you are losing the potassium, that way. All these conditions will give us hypokalemia. On top of that, we are sending in salbutamol. Wow. Then we'll run into severe hypokalemia. Also, we'll run into severe prolonged QT when we use allopurinol concomitantly with salbutamol. And I've explained, I think about 3 or 4 slides back, that prolonged QT will go down to tozadipone. Tozadipone going down to ventricular tachycardia, monomorphic, polymorphic, and down to ventricular fibrillation. If there's no deep fibrillation, then we run into asystole. Without advanced cardiac life support and reversing what is reversible, the patient will end up in the morgue. In pregnancy, inhalers are safe. Like if a pregnant woman is asthmatic, it's okay to use salbutamol inhaler. Yeah, but other formulations will call for caution. Okay, maternal pulmonary edema is a possibility. Then uterine activity can be affected by salbutamol. The beta-2 in uterus will lead to relaxation when you administer salbutamol. That is the mechanism that some people base the use of salbutamol upon as a tocolytic agent. It is not encouraged to use salbutamol or albuterol of any formulation as a tocolytic agent. You might go through so many other literature reviews that will tell you use it, use it, use it. What? Those who will choose to use salbutamol as a tocolytic agent will use the intravenous formulation. Mechanism of action. Salbutamol relaxes smooth muscles by beta-2 receptors agonistic effects. That is why it relaxes the respiratory muscles and uterine muscles. It has some or little effect on beta-1 receptors and heart rate. It inhibits the release of hypersensitivity mediators from mast cells. That is why in anaphylaxis or in asthmatic attack, we can make use of it. Monitoring. How can we know we are doing well or we are running into trouble? The symptoms will tell us. Are the symptoms abating or not? We'll know if we are winning or we're not winning. Then, forced expiratory volume in 1 second. What is the value telling us? Pointing to positive or negative. How about peak flow meter reading? What's the BP? What's the heart rate? What's the glucose level? Then the 6 or 7 times today potassium level, particularly in end-stage renal disease. Remember, potassium will be retained under this condition. EKG, we'll grab our EKG, check out for U wave, T wave inversion, ST segment depression, arterial blood gases, and renal function test. Now, examples of when and where we can use salbutamol will include combination of 2 medications like ipratropium and salbutamol under the brand name Combivent. Combivent is not the only brand name where we can get ipratropium combined with salbutamol, but that's the one I'm used to. So ipratropium 0.5 milligram with salbutamol 2.5 milligram under Combivent. You use that for nebulization and use that every 6 hours, but your physician will make that determination, or if your physician is confused, you can discuss with a pharmacist or clinical pharmacologist. Okay, remember that I've said that salbutamol is helpful as a rescue agent in the face of acute asthma or severe anaphylaxis with bronchospasm. If we are faced with that, admit. Check the O2 site. Check the arterial blood gas. Have salbutamol 2.5 milligram, ipratropium 250 microgram or 500 microgram, budesonide 250 to 500 microgram. Nab these 3 every 4 to 6 hours or twice daily. Then let there be IV fluid. Have saline in D5 at 100 cc per hour. 100 cc per hour is the maintenance. Then you can give your oxygen if O2 sat is less than 94. at the rate of 4 liters per minute per nasal cavity. And you have to treat concomitant upper respiratory tract infection. Can give your intravenous hydrocortisone at 100 to 200 milligrams start, then prednisone 60 milligrams per hour once daily for 7 days, but you tail off. If you are not winning with all these, then give magnesium sulfate intravenously. If you are not winning, then go for general anesthesia. If it is associated with fever, it's better to have chest X-ray done. Why that? To rule out pneumonia. And of course, while doing all these things, don't go that route alone. Contact the pulmonologist. If you are battling with acute case in children, we admit, we will do our arterial blood gases. Oxygen saturation 94 or greater is what we are looking for. Okay? If it's not, we'll give oxygen per nasal cannula. We will nebulize ipratropium with salbutamol with Pulmicort every 4 to 6 hours. May give intravenous hydrocortisone, but since we are dealing with children, the weight scale must be available. 6 milligrams per kilogram every 6 hours. Then prednisone 1 milligram per kilogram per hour once daily for 5 to 7 days. Then if we are not winning, the specialist can help us with omalizumab. And then some will go for intravenous salbutamol, although it's risky. But then we can't fold our hands and let the child die. Okay? You can, if you're not winning, then you can move on to magnesium sulfate. But you have to calculate based on the weight and must be given slowly over a long period, like 20 minutes to 60 minutes thereabout. Some will use aminovilline intravenously before considering general anesthesia. But that is to say, you can go for general anesthesia after magnesium sulfate use and you are not winning, but some will branch and give aminovilline before going for general anesthesia. Either way, discuss with your pediatrician or pulmonologist. Don't go that route alone. Okay, metered dose inhaler or dry powder inhaler. If it is 90 microgram, you can give 2 pulls every 20 minutes, and 3 of that could be administered while on your way to the hospital, or you've called 911 already. Or you can give this 90 microgram 2 pulls, every 3 to 4 hours, or every 4 to 6 hours as may be required. Some will be far away from the hospital. Okay. Ventolin discussed as dry powder inhaler at 200 microgram per inhalation could be given as 1 inhalation every 4 to 6 hours PRN. If your goal is to prevent exercise-induced bronchospasm, you can grab the metered dose inhaler or discuss inhalation. If you go for metered dose inhaler 90 microgram, you can give 2 puffs, 5 to 20 minutes pre or before the exertion, but usually 10 minutes before the exertion. That is to prevent exercise-induced bronchospasm. But if you are on DPI, then you can use Ventolin discus as 200 microgram per inhalation. Give 1 inhalation of that 15 minutes before exertion. If you are not winning, you've done all these things. You've gotten the list of allergies, you have abstained from it, you've done everything you're supposed to do, and the diagnosis is still asthma you are assuming to be. If asthma diagnosis is confusing, then start thinking. It could be vocal cord dysfunction. But how will you know? Vocal cord dysfunction will not have night wheezing, and there will be no symptom or symptoms at rest. It may be gastroesophageal reflux disease. Christian will tell you. Oh, okay, I'm not going into details of that one. I think I've spent a lot of minutes with you today. Check my channel for full presentation on gastroesophageal reflux disease. Might be postnasal drip. You are not winning. Might be cystic fibrosis. Check my channel for full presentation on that. Maybe Cardiovascular syndrome that will be comprising of repeated otitis media, sinusitis or rhinitis. Or might not be Cardiovascular syndrome, can be sinusitis on its own. So it's not all the time that the diagnosis of asthma will actually be asthma. So if you are not winning, consider this possible differential diagnosis. In conclusion, I've come to the end of the road when it comes to Salbutamol or Albuterol for now. I say for now because in medicine, something new might come up tomorrow. So go over the possible uses of Salbutamol or Albuterol, but take note of the following. In bronchospasm, either from asthma or COPD, or because of accidental attack faced with certain allergies anywhere suddenly, or because you're on certain medication, or because there's Hyperkalemia somewhere, then you need Salbutamol to help. But be careful you are not running into Hypokalemia. Check the formulations. You want to prevent exercise-induced bronchospasm, check the formulation because it will determine the amount of inhalations and the time before the exertion that you have to do. Watch for adverse reactions and warnings. Revise all of them so that your good intentions will not become evil spoken. If you are not winning, think again. Could it be cystic fibrosis? Could it be vocal cord dysfunction? Could it be rhinitis? Could it be Cardiovascular syndrome? Could it be gastroesophageal reflux disease? It might be postnasal drip. With that, I've come to the end of this presentation. Please kindly remember to share this with all your friends. Share it on your platform and leave your comments. Salbutamol or Albuterol, if you are in Europe or America, it's a good medication that will keep on helping human race. Thank you.